If you thought strokes were something that only happened to the elderly, you might want to think again. The American Heart Association estimates that 1 out of 6 people will experience a stroke in his or her lifetime. Watch on to find out about stroke screening and what measures you can take in terms of prevention and staying aware. I'm Rochelle Grossman, and this is a health feature. According to the U.S. National Library of Medicine, a stroke is a condition in which the blood flow to the brain stops and brain cells quickly begin to die. In some cases, a stroke may be preventable. However, some stroke risk factors cannot be avoided. Dr. Chaouki Khoury, a neurologist and director of neurology education and research at Baylor University Medical Center in Dallas, and an associate professor of neurology at Texas A&M. He explains that the main way to stay on top of strokes is by staying on top of risk factors.
So people need to be screened for blood pressure, and that's something you do routinely at your annual physical. People need to be checked for diabetes, depending on what their symptoms are. Depending on their family history, that's something the primary care physician will decide on. People need to be screened for high cholesterol, and that's something that's done routinely the older you get to make sure your LDL stays where it needs to be. Remember that cholesterol has 2 forms, HDL, which is the good cholesterol, and LDL, which is the lousy. L for lousy, that's how you remember it. So LDL is the bad cholesterol, and that's the one that has to stay low.
The presence of stroke risk factors does not mean that a person will necessarily have a stroke. Also, the absence of these risk factors does not mean that a person cannot have a stroke. And there may be some cases that call for more specific stroke prevention screening. These typically involve concern over hemorrhagic strokes, which may develop due to aneurysms or bulging, weak areas in an artery in the brain. For hemorrhagic strokes, Dr. Khoury says those who have a family history of aneurysms, malformations, or something similar can be screened by a doctor looking at their blood vessels. However, he adds it is not routinely recommended to do that since it depends on what your symptoms are. So what can you look for? How can you tell if a stroke is occurring? Follow Dr. Khoury's instructions. Now, if you suddenly lose vision on one side, lose the ability to talk or understand speech, or if you are going weak, numb, or lose coordination on one side, immediately call 911.
These are things that people need to be aware of so that if that happens, they immediately call 911. Remember, time is brain. So the longer you wait, the more brain cells are dying. So you need to call 911 as soon as these things happen.
There is no time to waste, so speak with your doctor today to be better informed of your risks and every step you can take in stroke prevention.